Hello everyone, we are going to study the blood supply of brain. Brain is supplied by two systems of arteries which is called as vertebral arteries and carotid arteries. The vertebral arteries enter the foramen magnum and run on the medulla, and at the lower border of the pons form the basilar artery. The basilar artery runs on the basilar sulcus, and at the upper border of the pons divides into posterior cerebral artery. It enters into the brain and divides into two terminal branches, that is anterior and middle cerebral artery. Look at the base of the brain. In the interpeduncular fossa, there is six-sided circle of Willis or circulus. The anterior cerebral artery communicates on the other side anterior cerebral artery to the anterior communicating artery, and the posterior cerebral artery communicates with the internal carotid artery through the posterior communicating artery. So the circle of Willis is basically a polygonal anastomosis between the branches of the internal carotid artery, that is anterior cerebral artery, and basilar arteries, that is the posterior cerebral artery. The middle cerebral artery does not take part in formation of the circle of Willis. Formation of the circle of Willis, the six-sided polygonal arterial anastomosis has anterior, anterolateral, posterolateral and posterior boundaries. Anteriorly, it is formed by the anterior communicating artery, anterolaterally by the anterior cerebral artery, posterolaterally by the posterior communicating artery, and posteriorly by the posterior cerebral artery. The lateral part is formed by the internal carotid artery. Coming to the branches of the circle of Willis, there are two types of branches. There are two types and the cortical branches. The central branches of the circle of Willis supply the interior of the cerebrum and penetrate the base of the brain. There are six groups of central branches, that is anteromedian, right and left anterolateral, posteromedian, right and left posterolateral central branches. The anteromedian branches arise from the anterior communicating and anterior cerebral artery. The anterolateral or the striate branches originate from the middle cerebral artery of the corresponding side. The striate arteries again divided into median and lateral group. Of the medial group, there is one large artery called as the recurrent artery of Hebner, which arises from the anterior cerebral artery. Then the posterior median central arteries arise from the posterior communicating artery and the posterior cerebral arteries. There are another set of arteries called as choroidal arteries, which are also grouped under central arteries as they supply the structures inside the cerebral hemispheres. These choroidal arteries help in the formation of the choroidal plexus inside, just supply the different surface of the cerebrum. The arteries supplying the different surface of the cerebrum are the branches of the circle of Willis, and they are called as the cortical branches. You are seeing this diagram of the cortical branches of the cerebrum supplied by the surface of the cerebrum. Arteries. Here the different branches are marked by different colors. That is, the anterior cerebral artery is pink color, the middle cerebral artery is blue, and the posterior cerebral artery distribution is yellow in color. So the anterior cerebral artery is the main artery of the medial surface, main arterial supply of the medial surface of the cerebrum, which supplies it via the frontal parietal branches. And the posterior cerebral artery supplies via the parieto-occipital and calcarine artery, and the middle cerebral artery supplies a small portion near the. This diagram is showing the superolateral surface of the cerebrum. The middle cerebral artery is the main artery supplying the superolateral surface of the cerebrum. The anterior cerebral artery supplies a 1 to 2 centimeter strip of the superolateral surface adjacent to the superomedial border. The middle cerebral artery supplies the most of the frontal lobe, parietal lobe, and the superior part of the temporal lobe via its frontal, parietal, and temporal branches. The posterior cerebral artery supplies the area near the occipital pole and lower part of the temporal lobe. This diagram is showing the inferior surface, which is mainly supplied by the posterior cerebral artery, which is marked yellow. The posterior half of the inferior surface of the cerebrum, which is called as the tentorial surface posteriorly, and small anterior part is called as the orbital surface. So most of the 3/4 of the tentorial surface is supplied by the posterior cerebral artery. A small strip in the medial part of the orbital surface is supplied by the anterior cerebral artery. The middle cerebral artery also supplies a small anterior part of the tentorial surface. This is showing the different surface and how they are supplied by the 3 cerebral arteries. Each area has one main arterial supply. Main stem is supplied by the branches of this vertebral system of arteries. The rest part of the cerebrum is supplied by the branches or other branches of the vertebral artery and basilar arteries. That is, there are pontine arteries supplying the pons. There are cerebellar arteries, anterior and posterior inferior cerebral arteries, and the superior cerebellar. Coming to the venous drainage of the brain, the veins of the brain drain into intracranial dural venous sinuses, which eventually open into the internal jugular vein. The vein emerges from the brain, travels in the subarachnoid space, pierces the subarachnoid matter and meningeal layer of the dura mater, drain into dural sinuses. Veins of the brain are divided into 8 to 10 in number, cerebellar veins and veins of the superolateral, and cerebral veins are divided into external and internal cerebral veins, which drain into the through the subdural space external and internal regions of the cerebral hemispheres. The anterior veins open at right angle, they are called as the posterior cerebral veins, which are divided into the superior, middle, and inferior cerebral veins. Runs in the lateral sulcus, which is again divided into superficial and deep middle cerebral vein. Then the inferior cerebral veins are very small and they drain the inferior and lower parts of the medial and superolateral surface of the cerebrum. Then there are other veins, that is the anterior cerebral vein, which accompanies the anterior cerebral artery around the corpus callosum and drains the parts of the medial surface, which cannot be drained into superior. Then there is basal veil of Rosenthal, which is formed at the base of the brain by the union of 3 veins, that is anterior cerebral, deep middle cerebral, and striate veins. The striate veins emerge from the anterior perforated substance. So the basal vein runs posteriorly around the midbrain and then terminates into the great cerebral vein of Galen. Thank you.